Is there a role for ketamine in treating chronic intractable headaches? 70-year-old Raymond Caturia has suffered from chronic daily headaches for close to 40 years. The patient has seen multiple neurologists, including at Mayo Clinic, and has attempted relief with nerve blocks, implanted stimulators, and tried multiple other treatments with no benefit.
I've gone from a very outgoing person to a more reclusive person because of
Right.
the headache pain.
Right.
Difficulty driving, reading, comprehending, remembering.
Constant headaches can be crippling to a person, affecting work, relationships, and quality of life.
Retired early 5 years ago
Okay.
because the pain was so great that he really couldn't concentrate at work anymore.
The patient hopes that ketamine can provide relief where other treatments have failed. In the days following his first 4-day infusion with ketamine, the patient noticed a drastic improvement in his headache symptoms, which lasted for almost 3 months.
It felt to me like the volume had been turned down on the world because I was so noise sensitive with the high level of headache pain.
Today's July 11th, 2011, and you're here for the 3-day ketamine treatment. And I think what we need to do, first of all, is give a little history on you. It seems over the past 30 years you've been getting this progressive headache. It's symmetrical on both sides. It follows the occipital, greater occipital nerve distribution for certainty, maybe a little bit of the lesser occipital nerve. And in the past you've seen numerous neurologists, including at Mayo Clinic, and some have come up with this diagnosis, a chronic intractable migraine without aura label.
That's
And
correct.
I think it's more of what I call a chronic occipital nerve neuralgia, which is intractable. Okay? Now, in terms of trying to treat this thing, you've had occipital nerve blocks, which haven't provided you with lasting benefit. You had a subcutaneous stimulator implanted, which hasn't given you a lasting benefit. Okay? Now, one of the things we talked about, and you did a great job of coming up with some things we can look at so we can get the most objective analysis in terms of outcome, is what can we look for that would really tell us that we did you good or made you worse. And what you came up with is usually to treat this, to get some kind of temporary relief, is that you apply ice packs, right? Sometimes, most of the time, 3 times a day, right?
Yes,
It does give you some temporary relief, correct?
it does.
Okay. And if that doesn't work, sometimes you'll use this vibrator or massage thing,
That's correct.
right? And then finally, sometimes you'll wrap an ace bandage, around your forehead. I bet you look cute when you do that.
That's correct.
So those are some things you've tried to do to get control of this chronic pain problem. And it has been quite disabling. Would you agree?
It has.
Okay. So, are you ready to do some exercises now?
I am.
All right, so the first thing I want you to do is do the vertical finger test. Look straight ahead, don't follow me. Put 2 fingers in your mouth and tell me if you have any pain when you do that, when you open your mouth that wide.
No.
Any pain? Good. Okay, I want you to take that right hand and put it behind your head, please. And are you having any pain when you do that?
No.
I'll take that down to the left hand behind your head. Tell me if you have any pain when you do that.
Not in my arm. The headache still hurts.
Does it exacerbate your headache when you put your arm up there?
No, it does not.
It does not. Good. Okay, next, take that right hand out in front of you and open and close as fast as you can. Fast, wide open. There you go. On the left, do the same thing. Good. Now we're going to turn our attention down to your legs. I want you to rotate your ankle as best you can on the right. Good, good. Wiggle your toes. Okay, and hitchhike on back to wherever you came from.
Minnesota.
Minnesota, right. That's MN, right?
Yes.
Okay. And on your ankle, do the same thing on the left. Good. Wiggle your toes. Hitchhike back to Minnesota. Very good. I want you to get up and stand in front of the door there. And I want you to take 3 steps toward me and 3 steps back, okay? And take 3 steps back. Okay, very good. Do you have any pain when you did that?
No.
I want you to tippy toe 3 steps forward, 3 steps back on your toes. Take your time. That's it. Good, good, good. And back on your toes. Okay, good. And your coordination looks pretty good in that regard. Did you have any pain when you did that?
No.
Finally, this is a little bit more of a challenge. I want you to take 3 steps on your heels, please. That's it. Takes a lot more balance to do that. It is a little bit, that's right. It is more a challenge. Okay, going back. Did you have any pain when you did that?
No.
All right. Now you felt that you looked a little unsteady with that. Okay.
Mm-hmm.
I want to document this a little bit more clear. So I want you to take and just kind of as best you can walk down this line right here,
Okay.
and on your heels, please, as best you can. That's it. If you're going to lose your balance, let me know. Okay. Very good. Okay. Go back on your heels. Yeah. That's a little bit more of a challenge. Would you agree with me?
It seems the muscles in my legs are really tight.
Yeah, no, that's fine, that's fine. Okay, we're going to take a look at that after we're done with you and see if that improves. Go ahead and sit down, please. Now, we talked about the fact that this 3-day ketamine treatment was developed for neuropathic pain, which you have, but specifically for complex regional pain syndrome. So we're kind of stepping out on some new territory here, right? And you can't expect me to come up with a lot of numbers here on what the outcome is, so we're kind of stepping out. We all understand that, right?
Yes.
Now, in terms of risk, we talked about the possibility of an adverse hallucination, which is unlikely but could happen, okay?
Yes.
And you are getting anesthesia, but we're not putting under general anesthesia, okay?
Yes.
And tomorrow, you're going to be watching that 12-minute video, and you're going to ask me questions tomorrow if you don't understand part of it, right?
I will.
Let's turn to your wife over here. What do you think? Do you think he's getting worse with this by the day? Pretty much?
He definitely is worse. In fact, he retired early 5 years ago
Okay.
because the pain was so great that he really couldn't concentrate at work anymore.
Right, and his age right now is?
He's 69 now.
69, got it, okay.
So, yes, I would say he's more irritable. He's definitely, he tries very hard to do things in daily life, but definitely impacts his behavior and social behavior.
Of course, sure, and that makes a lot of sense, right? Do you have anything to add to that? Is that pretty much put it in a capsule?
Pretty much it. I've gone from a very outgoing person to a more reclusive person because of
Right.
the headache pain.
Right,
Difficulty driving, reading, comprehending, remembering, and
right. What happens when you're driving? Because we talked about that earlier. How does that impact your driving?
I think anybody that's had a headache and has driven knows that it takes extra effort
Right.
to concentrate around the pain, and it just takes a lot of extra effort. And
Sure.
people drive more aggressively. It's hard to anticipate some of the things
Sure.
that happen.
Sure. Do you have any questions about the 3-day ketamine treatment?
I do not.
Okay, very good. We're going to go do your photos now. Oh, and by the way, one of the things I noticed about you is you got more swelling on that right eye of yours, okay? So we're going to
Okay.
document that on some still photos, okay?
Okay.
See if we can improve on that. Okay, Raymond, it's now July 18th. We finished the 4-day ketamine infusion, actually about 3 days ago. And today is Monday. You're back for our follow-up outcome evaluation.
Yes.
I'd like to talk a little bit about how things went during the infusion. In your situation, we were able to get you up to 200 milligrams per hour of ketamine. The only thing that limited us a little bit is that you were completely, how would you say, anesthetized to the point you couldn't answer simple questions like, who's this lady over here? What's your wife's name?
That's important.
Yeah. Oh, yeah. We had her worried about that, a little bit. The other thing here is that your vital signs were extremely stable. We had no issues there whatsoever. You would agree with me?
Yes.
Yeah, okay. And there was no nausea, vomiting, no adverse hallucinations, okay? You were comfortable with the high-dose ketamine.
Yes.
Now, just in summary then, you came to us with a 30-year-plus headache in the occipital nerve distribution. Show us with your hand where the headache lies.
Actually, the whole head.
The whole head. And actually had some components going down into your lower back neck, right?
That's correct.
So why don't you point to that so we know where that is. Go ahead.
The pain also went down my neck, into my hands, fingers,
Okay.
arms,
Okay.
and down into my shoulders and stuff.
Right. Was it going more into the right arm or the left arm, or about the same?
About the same.
Okay. All right. Very good. Now we want to walk you through some of these exercises. Okay. Even though they were fairly normal to begin with, want to make sure Dr. Kirkpatrick didn't create any new problems. Okay.
Sure.
So do the vertical finger test. 2 vertical fingers in your mouth. Any pain when you do that?
No.
Okay. Good. Now take your right hand, put it behind your head as if you're going to comb your hair. Any pain when you do that?
No pain.
Take that down. Put the left hand behind your head, please, and see if you have any pain.
No pain.
Take your right hand out in front of you, open and close it, making sure you do your thumb. Good, as fast as you can. Good, good job. Any pain when you do that?
No.
How about the left side? Good,
No.
excellent, excellent, good. Now take your shoe off for a minute and rotate your ankle on the right side first and wiggle your toes and hitchhike back to Minnesota. Okay, very good. Now do the left, please. Rotate, wiggle your toes. Okay, and hitchhike on back to Minnesota. Very good, excellent job. Now what I'd like you to do, Raymond, I'd like you to go over there and just kind of move those, don't trip on your shoes now. Move them out of the way. Attaboy, good. And I want you to just go ahead and walk toward me. 3 steps. You can just regular walk. Walk on back. You have any pain when you do that?
No.
All right, now I want you to up on your toes and see how you walk with your toes, please. 3 steps on your toes. 3 steps back, please. Okay, very good. Now walk on your heels, please. Very good. Excellent. Excellent. Okay, very good. Now go ahead and you can sit down now, please.
Okay.
All right. Now let's take one day at a time. Okay. So Friday, when you left here after your last fourth day of the infusion, okay, tell us how that went, and I'll ask your wife to weigh in if she has any additional thoughts on that. Okay. Go ahead. Tell us how it went.
When I left here after the treatments, we drove back to Fort Myers, and I had...
And so everybody knows that's is that about 150 miles or something like that?
Yes.
South of here. Okay.
Yes.
Okay.
And at that point, I had no pain. That
Okay.
was after the 4th day treatment.
Right.
One of the things I commented to my wife as we drove back in the car was that it felt to me like the volume had been turned down on the world because I was so noise sensitive with the high level of headache pain. All of a sudden, little noises didn't bother me as much as they used to.
And little noises could be like you're in a restaurant, right?
Yes. Or
Restaurants are not part of your program because of that, right?
That's correct.
And your wife with her hair dryer, that's not part of your program either, is it?
No, that's correct.
Because just a hair dryer is enough to make it a very painful experience for you, correct?
Yes.
Okay, go ahead.
And I did a little driving on the weekend, but that's pretty much the difference on Friday.
Okay.
Saturday morning.
Whereas driving normally you'd be a little bit fearful of an accident, correct? Because
That's
of the
correct.
headache. Is
It's
that right?
too hard to focus around the higher level of headache pain.
Gotcha.
But Saturday morning when I woke up, I had pain only in my forehead,
Okay.
where before the pain would have been in my whole head.
Right, so point to
shoulders.
where that headache was.
Just across my forehead.
Right
here.
there? Okay,
Yeah.
all right.
And I took some Advil, and that seemed to lower the pain back down for the rest of the day.
Now I'm going to comment on that, okay? The way you describe your pain, that's not an occipital nerve pain, okay? That's a tension headache, okay?
Okay.
Type picture, okay? And I would expect the Advil to help you with that, did it?
It did.
Yeah.
Yes.
Whereas occipital nerve neuralgia, I don't expect Advil to do much for that, okay?
Yes.
Is that true from your experience?
That's true. I think the Advil before would just take the edge off the pain.
Right.
Or
But
the secondary pain.
But that
in
pain
my
you had in your
shoulders.
forehead, it would seem to be more effective?
Yes, it did.
And by the way, we had a little conversation before this. We really emphasized how critically important it is to be as objective and candid as possible about the outcome here, right?
That's
And
correct.
if you had some bad experiences or if this thing didn't really help you, you were going to tell it like it is, right?
I sure would.
Okay, all right, very good.
Saturday, we took it easy because the weather wasn't great, and we did a little walking, but I didn't have a lot of energy. And then on Sunday, yesterday, I had no headache pain, no Advil, no nothing, and I was quite sleepy all day and wound up taking 4 naps, which seemed refreshing and helpful. So
When's the last time can you remember without any treatment that you would have expected to have a headache on Sunday?
I had my headache every day,
Every day.
night. I mean, it was 24/7.
24/7, right.
Yes.
So the fact that on Sunday, which is a day or more after the infusion, you had no headache. You knew something had changed, correct?
That's correct.
Okay, go ahead.
And since then, it's just the lower headache pain. I think helps me be less impatient and crabby with my wife, and it just I've kind of savored it for the whole weekend. It's been a better feeling. So.
I understand. Now, you did mention something about how another thing you noticed is the pain would radiate down into your down in the lower part of your neck into your back. Did you that with it in the past? But that didn't something about that pain.
That's correct. I always assumed that the neck and shoulder pain was related, secondary pain to the headache problem, and that I just tightened those muscles subconsciously. But about 6 months ago they discovered severe arthritis in my upper spine, and it seems like they're now feeling that the upper body pain in the shoulders, neck, and arms and that area is caused by the arthritis. But I still don't have any pain in my shoulders, neck, and arms since the 4th treatment on Friday.
Right.
And haven't had any all weekend.
Right. And I'm going to ask your wife here, do you feel like his mood has changed? Is he a little bit more positive, more hopeful?
I think he definitely is more hopeful. He's been more lethargic and tired, I think, on Saturday and Sunday.
Right.
Today is Monday.
Right.
So, and I think there is that unconscious feeling, is the pain going to return?
Right.
And so I think there's an adjustment time for that also.
Yes, right. And the fact that he had a tension headache, the stress of worrying about it coming back is something that needs to be considered. And stress management, I think, is going to be an important part of your rehabilitation. I've suggested that you find, if you can, where you live in Minnesota, find a good clinical psychologist that can do 2 things for you. Number one, can help you with stress management. We all need that, right? And especially you with chronic pain. And secondly, to help you with sleep, okay? Where you don't have to take Ambien or something like that.
Okay.
Get you off that medication, okay?
Okay.
So we've talked about that. And the other thing we talked about in trying to get you so that you don't need another ketamine infusion is exercise, didn't we?
Yes.
And we talked about if you get in and let's say you decide to do heated pool exercises, which I've recommended. There's other exercise you can do. Because remember now, your extremities are in pretty good shape, and you don't have any evidence whatsoever of having complex regional pain syndrome. But you can do a hell of a lot more than the average CRPS patient.
Sure.
Okay. So you maybe some other exercise you can do. Just be careful you don't injure yourself. Now let's say you go out and you do whatever, you do your heated pool exercises and you have pain during and after. Is that necessarily a bad thing?
No.
No, it's not. Why is that?
I'm using muscles and
Right.
doing things I haven't
Right.
done before.
That's right. You're getting back in shape. That's
no
right.
pain, no gain.
That's right. Now, on the other hand, what did we say? What's a bad hangover?
If the pain continues after I stop exercise.
That's right. And so if you're laid up for day 2 or that sort of thing, that's a bad hangover. You
Yes.
don't want those. So you're going to have to figure out where your happy medium is. And the best place to start, because it's easier to monitor it, is the heated pool exercises with a little stopwatch, that sort of thing.
Okay.
And you're looking for improvement in exercise tolerance. As long as you're improving in your exercise tolerance, and we talked about that, you don't have to be so anxious about having another ketamine infusion. Okay?
Sure.
All right? And as we said right from the very outset, you're one of the few that we've done here. After thousands and thousands of CRPS patients, we're one of the ones where we've had this chronic occipital neuralgia, is what I call it, that's been going on for, decades. Okay? So you're kind of like a trial balloon here, so to speak. So we'll just have to monitor you very carefully here. And hopefully you'll take me up on my offer and come back, in a month, 2 or 3, and let us reevaluate your situation.
We sure will.
Okay? Any questions?
Not that I can think of.
See if your wife has any questions.
No, we've just thrilled with the huge reduction in pain and looking forward to a lovely life
Good.
without pain.
Yeah, absolutely. Okay.
3 months after his first infusion, the patient's headache has returned at a slightly smaller scale. He returned to Tampa for another infusion.
The ketamine is the only thing that has given him
Right.
any kind of sustained relief
Right.
for more than just a
Right.
few hours.
Okay, Raymond, today is October 24, 2011, and by way of brief summary here, you're a gentleman that's had an occipital neuralgia for some 30 years, right?
Correct.
And unrelenting, daily, all the time type thing. It's been seen by many headache specialists, okay? So you came here with the hope that maybe the ketamine infusion, high dose, would be helpful. So we did a 4-day on you that it just stopped your pain for the first time. And that was 3 months ago. And so this is basically an update. And what's happened in the meantime, some of your pain is starting to creep back. But what we want to focus on, but it hasn't come back to the same level. Am I correct on that, Raymond?
That's correct.
Okay, all right. And what we want to focus in on is some of the things that you've noticed as a consequence of reducing the headache pain. Let's start with your ability to concentrate.
My ability to concentrate has been greatly improved. I've been doing a little more driving and just certainly enjoying life with the lower level of pain.
Right. Another thing is that you used to do some pretty desperate things to try to control your pain before, right? Like ice packs and all this kind of stuff. Why don't you talk about that and the medication issue a little bit?
There was literally no medication. They tried every narcotic, every kind of treatment, surgery with a electrical stimulator in my occipital nerves.
That's right. And it was subcutaneous, wasn't it?
Yes.
That's right.
And nothing worked. The only thing that has helped is the ketamine.
Oh, yeah.
It's the only thing that touches my pain. But in my daily struggle with the pain, especially on the bad headache days, I would take up to about 30 Advil a day. And
30 Advil, you know, that can chew up the stomach on somebody when you're having a bad day, right?
I realize that, but I was desperate.
Right, I understand.
And the Advil would just take the edge off. It didn't seem to greatly impact the pain, but I just needed any help I could get.
Right.
Then I used ice packs. I had a vibrating machine, a massage machine, and I had an elastic ace bandage that I would put around my head that would
to make you look cute.
put pressure on it. Yeah, none of it looked cute. But those things, using those things has been greatly reduced. I still have some bad headache days once in a while, but not anywhere near where it used to be.
Right, right. And so we have the usual cell phone thing.
Sorry.
We caught you, didn't we?
Mm-hmm. Sorry.
So why don't you tell us about, from your perspective as an outsider, how you've found him? Is he easier to live with?
Yes, I think he's
Sorry to interrupt.
much more. Should I go ahead?
Yeah, go ahead.
He's much more, I would say, communicative, much more upbeat, much chattier, much more willing to go out with friends, his friends, you know, but much more social, able to go to some restaurants that are a little tiny bit noisier. I would say physically, his eyes are not as swollen around the eyes down here.
Right, right. I think we took some photographs of that too, didn't
Yes.
we? Before and after. Yep.
Yes.
Yep.
So I think in some ways he's been reluctant to do much more than socially or to actually have a scheduled something physical scheduled, because I think he still is expecting the pain to come back, and he's afraid if he has something scheduled he would let people down.
Right, right.
But the pain has been very slowly coming back over these last 3 months.
Right. And so our plan now is to do another 4-day ketamine infusion, and we're going to try to document as best we can outcome here, as objectively as we can. Unfortunately, unlike the CRPS patients, which you're not, we can't measure, use the pain thresholds as an objective measurement and, you know, function as we normally do. So we're just doing the best we can. That's why we're documenting this on video. And then finally, I just want to ask you, for purposes of education, is it okay to make this available to the public for purposes of education?
Absolutely. I hope it can help somebody else.
Yeah. Well, I'm sure it will. And because, you know, you've been to some of the more notable headache facilities, including Mayo Clinic, and nothing seemed to work there. Am I right on that?
That's correct. Several times through the Mayo Clinic.
Several times, okay. And I want to make sure it's okay with your wife here.
Yes, it's fine.
Okay, very good. Okay, Raymond, it's now October 31, 2011. It is Halloween. And it so happens this is you had the 4-day ketamine infusion, and that was done and the infusion ended on Friday. So now we're at least 48 hours post that infusion. And so you had the weekend to kind of exercise the new body, okay? And one of the things I want to point out that we haven't pointed out before is that when we look at your pain thresholds, they're abnormally high, meaning, translating into English, means that you can tolerate huge amounts of pressure on your forehead, your thumbs, your toes, your heels, without saying ouch. In other words, it doesn't feel like it's painful to you, okay?
Yes.
So, so that's a little unusual. Now, as we know, you don't have CRPS, but you got this chronic daily headache, which appears to be occipital neuralgia, okay? Now, one of the things you mentioned to me earlier, which I didn't appreciate, is that when you were 15 years old, okay, you had this tight sensation around your head, and you complained to the doctor about it. That tight sensation, when you reached about 30 years old, became a painful sensation. You had all the usual, imaging studies done, and nothing came up on that. To make a long story short, and this is the important thing, this pain has evolved over the last 40 years, and it's progressive. It has not gotten better. It was getting worse when I first saw you, and some 3 to 4 months ago, and we did the first ketamine infusion on you. Am I correct on that?
That is correct.
And you've had all sorts of different treatments. I mean, just you can imagine anything Mayo Clinic could throw at you as far as treatment options have been done. Nothing has ever had an impact on your occipital neuralgia other than the ketamine, correct?
That's correct.
And even when you had the occipital nerve blocks, you got the numbness there, but you really didn't. The pain was sort of kind of masking the pain. The pain was still there. Am I correct?
That's correct.
Okay. So, so we did about 3 months ago, we did your first ketamine infusion for 4 hours, and you had a partial remission. So when you came back, you were still doing better. And then now we did another 4 hour on you. And we noticed on the first infusion that your face looks like there was less swelling as a result of the ketamine infusion, which is an objective measurement. Which leads me to my next point, is that unfortunately with your problem, your chronic pain, unlike the CRPS patient's pain, it's hard to get objective measurements, okay?
Yes.
Except for perhaps the swelling in your face, which you've noticed when your headaches get worse, the swelling goes down. When you get ketamine, the swelling goes down. Am I correct on that?
Yes.
Okay. Now, this time when you had the ketamine infusion, why don't you compare that with the first one and tell us what you think, okay?
Overall, I think I tolerated the 4 days, 4.5 hour treatments better this time because it wasn't such an unknown. I wasn't quite so frightened about what was happening and what might happen. So the process was easier for me. The pain on the first round of treatments, when I left after the 4th day, I had no pain whatsoever. On the second round of treatments, I still had pain, but it was greatly reduced. And Saturday, I had a very good day. I felt good, enjoyed the day a lot more. And yesterday, the headache was a little bit worse again, but today it's come back down and I feel better. So
yeah. And Stephanie, why don't you comment? This is his second ketamine infusion. Why don't you comment on what your thoughts are? Because you've suffered you've known him for 20 years, and of course you married this headache, right?
Correct.
This headache guy. And so, what do you think? Because you've been through a lot of these different treatments and everything. What do you think of the ketamine? Do you think it holds promise? I mean, he's only one patient, but a lot of people do have these chronic daily headaches, which nothing works. What are your thoughts as an outside observer?
I can only go by what he says, but it certainly seems like the ketamine is the only thing that will make the pain actually go away and not mask the pain. He has taken, over the years, hundreds of different medications, some of which reduce the pain, but always there were terrible side effects, or it just didn't do enough to make it worth staying on that particular medication.
Well, not only medications, but he had little wires implanted under his skin
Yes.
and to stimulate his occipital
Yes,
nerve.
that's right.
And in order to get any impact, he had to turn it up so high, the pain from the stimulation was more painful than the headache.
It apparently vibrated in his head, and he found that worse than the pain.
Right.
So the ketamine is the only thing that has given him
Right.
any kind of sustained relief for more than just a
Right.
few hours.
So I think, and with a great deal of caution, what we should say is that this looks promising. We have to do more patients to get more data. But certainly, this looks very promising for perhaps tens of thousands of people that suffer from daily chronic headaches as a way out of a situation that seems to be pretty hopeless. You think that's a fair way to kind of sum things up here?
I do, and the opportunity to at least have some hope of relief is psychologically so meaningful.
Right. Now, we also talked here, Raymond, about going forward how important exercises are for you, keeping yourself very active physically. Now that you've gotten some degree of pain relief, and you're certainly better off now than you ever were before we started these ketamine infusions on you, taking advantage of that and being as active physically as possible. Heated pool exercises, cycling, anything like that. Unlike the CRPS patients, we don't have to worry about re-injury in your situation, okay? So I would encourage you to be as active. I know you, without prodding you too much, I know you want to be, so that's a good thing, right? Right. And, okay, anything else? Any closing thoughts?
No, we're just so grateful to have access to these treatments and that there's hope now for him.
Okay, good. How about you, Raymond? Any closing thoughts?
I'd say the same thing.
Okay, very good. Excellent. And by the way, everybody wants to know one thing. How old are you?
I'm 70 years old.
And when did that happen?
Last Friday.
That's right. So happy birthday.
Thank you.
Although the results from this case are promising, further studies are necessary to demonstrate the safety and efficacy in treating chronic intractable headaches.